And coming up next, our medical files turn to chickenpox. Some see it as a rite of passage.
Well, doctors say it doesn't have to be so. Vaccinating against chickenpox, we'll get the details from some doctors. That's right after the break.
Welcome back to the program. Now, chickenpox, an infectious disease characterized by fever and small red itchy spots, appears to be on the rise in Asia.
Countries like Singapore, South Korea and China have all seen an increase in infections in recent years, but it can be avoided by mere vaccination.
Now, many parents, though, resist getting their children vaccinated. They think it's a harmless disease, but doctors say that's not always the case, as serious complications can emerge, plus severe scarring.
Well, this morning we have Dr. Leslie Tie and Dr. Sim Kong Cho in the studio with us to tell us more about this topic. Good morning, gentlemen.
Hi.
Let's start off. I mean, chickenpox, I've had it as a kid, you know, and you kind of go through that phase. It's sort of like, as we mentioned, a rite of passage. So why are you guys saying it doesn't have to be so?
Well, the thing is, now, when we were children, we didn't have a vaccination against chickenpox. So a lot of us had to go through chickenpox. We had to go through measles. But nowadays, you don't see kids going through measles as much because of the vaccination program that they've instituted. Chickenpox vaccine came out in 1996, but it is not compulsory in Singapore. So some parents are still very resistant to having their kids vaccinated for whatever reasons.
I guess one of the problems is because parents don't see it as such a terrible disease, but serious complications can arise from this. Give us an idea how.
Lucky thing about chickenpox is that 95% of the time the chickenpox scars disappears. But if it gets infected or it involves the epidermis, which is the lower part of the skin, you can be left with a permanent scar. And in this current day and age, if you can prevent something, it might as well prevent it rather than wait for the scar to happen and try to get rid of the scar, which might cause more.
Right.
I guess one of the concerns with having anything injected into your body, vaccinations, you're thinking, well, I'm just suppressing it. It may still come back later on, and then I don't want to get it when I'm, I don't know, 30 years old, right? Is that true? I mean, does this vaccination just put off what might occur later on?
Okay, you've heard of families or mothers trying to organize chickenpox parties, right?
You know, I've honestly not heard of it, but when I did hear about it, I thought that was pretty funny and ridiculous.
Yeah, well, the whole premise of the chickenpox party is to get your child exposed to the chickenpox virus, and then when the child gets the chickenpox virus, they'll then develop all the pox. When you do a vaccination, it's essentially almost the same thing. You're giving yourself a very weakened form of the virus. So the virus gets into the body recognizes it's the chickenpox virus, but the virus is not strong enough to cause the very severe outbreak of chickenpox. Right. So essentially you're doing the same thing. So
it's more controlled in a sense.
That's
you know what is going to happen, and doctors are on the lookout for it. But when you look at children and adults, when they have chickenpox, you find that adults have it more serious. I mean, you know, it's more benign symptoms in children.
For adults, chickenpox it's more severe. You can get more pox marks, and the adults have a higher chance of getting hospitalized because of pneumonia, because of brain infection, and even death in severe cases.
I mean, I've heard of stories where women who are pregnant, they get chickenpox. Of course, that's very serious at those stages when your physical body is in weakened state. Now, we've just got some images here, as an example of some of the physical scarring. I mean, the chickenpox that you have when you have I mean, as we know, it's all over the body and you're itching everywhere.
Give us an idea, what happens? So what does it do to our body?
When the virus, when you get the virus, it undergoes an incubation period, and after which it will migrate to the surface of the skin. And it will multiply under the layer of skin, and it causes the vesicles that you see right now.
Right.
And in most cases, all these vesicles will dry up and they will scab off, and you shouldn't be left with any scars. But in some cases, if this vesicles gets infected, or the child or the patient scratches it and causes a secondary infection, that might cause a permanent scarring that you see, which is a depressed scar, and that is much harder to treat.
So in other words, if I have it really bad and I scratch really hard and I break any of these spots here, it could result in permanent scarring.
Yes, that's correct.
And can that be corrected later on?
Yes, there's a couple of ways. You can do a minor surgery where you can cut out the scars, or you can do a subcision whereby you insert a needle under the scar and try to tease the scar up. And right now we have a new technology whereby you use fractionated CO2 laser, and it involves stimulating collagen growth in the scar area. But in most cases, we might not be able to get rid of the scar 100%, but you should be able to get at least a 50-60% improvement.
Right.
Are you seeing an upsurge of patients or visitors to your clinic to receive this sort of treatment?
For scar treatment, yes, I see around a 5 to 10% increase year on year. I think the reason is that one thing is there are more people getting chickenpox, and of course the second thing is there are more people who know about treatments that can be done for chickenpox scarring.
But if you get vaccinated, doctor, what would you say is, the ideal age, if there is one, for children to get that jab?
Well, you can't start jabbing the kids at 12 months as 1 year old. I guess any time is a good time to do a vaccination. If you are an adult, if you're already in adolescence and you haven't had chickenpox, then it's a very good idea for you to get the jab. Especially if you're a young lady planning to get married and planning to get pregnant, because as you know, if you get chickenpox during pregnancy, especially the first half of pregnancy, can result in deformities for the child. And if you get it during the time when you're just about to deliver, you can then pass on the virus to the newborn baby, and it's very high risk that the baby can even die of chickenpox at that age, because its immune system is very weak at that stage.
So what if I'm an adult now, I've never had chickenpox, I don't remember, and I don't know if I have, the immunity in me, how do I go about?
Just go and get a jab. It's simple.
I mean, but what if I already have the...
if you've had chickenpox before, can you still get the jab?
It's all right. It's all right.
Can you get it again? Because we always believe that once you get it once, that's it. It's a lifetime, one-time thing.
Chickenpox is very interesting because there have been cases where patients have come to the clinic saying, my mum says that I had chickenpox before, so this can't be chickenpox. It's staring at you straight in the face. It looks like chickenpox, and in every sense of the word, it is chickenpox. But they swear, they say, no, never. My mum said I had chickenpox. I can't have chickenpox.
Sometimes
but
it can be confusing, measles and chickenpox. Just one last question. There is this old saying, you hear mothers saying, don't eat seafood, don't eat eggs. It will cause more scarring. Is there any truth to that?
No, there's no scientific proof to all these things.
Yeah, I guess they say don't eat dark food because then it will darken the sky. I mean, well, you really think about it, right?
I think though one thing to note is that a lot of them say don't bathe. And that's very important for you to actually keep yourself clean. You should actually bathe, keep yourself clean so that it doesn't get infected. And that's when you start scratching, and that's when the scarring starts.
I know one of the other things I used to do is that you put a lot of calamine lotion so you don't scratch and you keep the itch away. But can you take medication to help alleviate the itchiness from chickenpox?
Yes, there are medications you can take. There are antivirals that you can take if it's a very bad outbreak. And of course medications and lotions that you can use.
And just very quickly, the vaccination, how long does it last?
It's supposed to last for life. At this stage, we don't really know because the vaccination has only been around for 10 years. So at this stage, we are saying yes, we believe that it will last for life. But as time goes on, we'll know better
But for now, guaranteed 10 years at least. Thank you so much both for coming in. So chickenpox is not as benign as it seems. We've just been talking to general practitioner Dr. Leslie Tay and aesthetic surgeon Dr. Sim Kwang Cho. And they say it's important to get vaccinated for chickenpox in order to prevent possible onset of serious complications. So do consider that if you have had or not had chickenpox.
Although it was kind of fun because both my sisters had it. We stayed home, we kind of played games, and well, I mean, we weren't. When you're not really itchy, I mean, you kind of get to hang out. It's like time off from school.
No, I've not had chickenpox, but I've had measles. But I've tested myself, and I am immune, so don't worry about it.
You got a special immune system going on. Okay.